Welcome back, everybody, to the GuideWell Insights Lounge. My name is Kate Warnock, and we're coming to you live from Singularity University's Exponential Medicine. My esteemed guest joining us here in the Insights Lounge is Ariel Garten. Ariel, welcome to the interview.
Thank you, happy to be here.
So Ariel, I think, is very well known at the Exponential community. She is the CEO of InteraXon Incorporated. Ariel, you have a fascinating new product. I was hoping that you could tell us more about Muse.
Sure. So this is Muse, the brain sensing headband. It's a clinical grade EEG with 4 channels, 2 on the forehead, 2 temporal. Slips on just like a pair of glasses and tracks your brain activity in real time, sends that data to your smartphone or tablet. So from this simple little platform, you have a wide variety of applications. We have over 120 different research partners using Muse in a wide variety of ways, from looking for neurofeedback applications for ADHD, neuromarkers for depression, tracking of epilepsy long-term, and on and on.
You know, we were talking before, Ariel, and that you have a very interesting use case specific to meditation. Tell us how Muse helps facilitate that for people.
So everybody knows that meditation is good for you, and meditation is really becoming a frontline approach in healthcare. There was the recent study out of Benson Henry Institute and Partners. Are you familiar with it?
I'm not sure, no.
So Harvard just took about 10 years of Partners data from the Partners healthcare system,
right,
and they looked at individuals who'd gone through a relaxation response course for 6 weeks. They then tracked their outcome over the next year in terms of how much healthcare usage they had. And after a 6-week course in relaxation response, i.e. yoga, meditation, they had a 43% decrease in healthcare usage the following year, relative to 13,000 controls. This was a 17,000 person study.
Oh my goodness.
So people are really starting to pay attention to meditation and its ability to have a massive impact in healthcare.
Absolutely. So another use case that you had mentioned was specific with Mayo Clinic and using it with cancer survivor patients. What was that program like?
So with Mayo Clinic specifically, we have breast cancer patients coming in 4 weeks prior to surgery, and they're given a Muse to help manage the stress of the surgery process. And so we're demonstrating a decrease in stress, and Mayo hopes to also demonstrate an improvement in recovery times, cost savings.
So really, I mean, I think what you've discovered and what you've created is a platform that is obviously very simple, it's frictionless, and it feeds right into a device that someone might have like a smartphone. So where do you see taking this technology as you iterate out?
So the first round of applications that are really getting massive traction is in meditation. This is the easiest way to implement meditation in your healthcare system. Your patient comes in, they've got hypertension, they've got a condition that you typically would give them a prescription for meditation, but you don't know how to meditate, your patient doesn't know how to meditate, you tell them to go meditate, it doesn't work. Now you just hand them a Muse, and they go home, gives them real-time feedback on their meditation, teaches them what to do, and you as a doctor can track the compliance with something that's been validated in multiple studies.
You know, so Ariel, I think what Muse also does, you know, we've had a lot of guests at the Insights Lounge, and they're talking about holistic care. And really what I think Muse is doing, it's tapping into the fact that it's not just a physical ailment, it's really the whole person that you need to address. So obviously, I was hoping, pivoting a little bit, you obviously sense that there was an opportunity to do more with addressing the whole person.
Yes.
How is it that you would advise someone who is looking to go into healthcare, the healthcare industry, to really focus on the right problems to solve?
So the good news about somebody entering the healthcare industry today is that opportunities are massive. So if you see a key opportunity, a key problem that you can solve, you shouldn't be hesitant to go into it. In the past, you may feel like there was resistance, oh, the FDA might shut me down, or, you know, healthcare's dodgy, they're not going to accept what I'm doing, or, you know, insurers are closed-minded. None of that is the case right now. The FDA is very willing to engage in dialogue. The FDA wants to help and support your solution rather than shut it down. Healthcare systems overall are looking for novel solutions as quickly as they can find them, and they're willing to invest in novel solutions so you as an entrepreneur can really leverage that opportunity to have studies done, to, you know, have investment made, and move forward on your product with the support of the system rather than feeling you're working outside of it.
And I think probably another critical thing that you brought to market clearly, you're empowering a patient. And I think, again, another theme that we see here at Exponential Medicine is around the empowered patient. How do you see tomorrow's patient being even more empowered?
So today, hopefully today's patient and definitely tomorrow's patient is going to be empowered with data about their experience. You're going to be empowered with a tool to be able to help you with your own condition. So you may go to you hopefully will still go to a doctor. A doctor is still an important part of the loop, but the doctor can guide you with tools that you can then take home and implement yourself. And with tools and technologies that are going to let you build a better life day by day.
Right.
And tools and technologies that aren't only about addressing disease, but also about preventative health. We're all going to have a suite of things that we do to maintain our health, not simply to make us better when we're sick.
You know, Ariel, I think again, you're a proven expert in your field. You know, we sitting here in the innovation lab, we have a number of people who have new technology, and you know, I think that a critical characteristic of most of them, and particularly yours, is that you have not forgotten the human side of healthcare. Do you have a particular experience or anecdote that you would share that really helped you develop where you are today?
So when we first brought Muse to market, we knew it was going to help people. That was really the driving goal. We wanted to make a tool that was going to help people in their daily lives improve. And that validation came back so quickly. The very first email I got back after Muse was in market for 3 weeks was a girl who was 27 years old. She'd been off ADHD medication for 4 years. And she wrote me a note saying within the first 3 days her family had noticed a difference. And within 3 weeks of using Muse, this was not just a game changer, it was a life changer.
How about it?
So we keep seeing these extraordinary examples, and that was simply the first one. There's now hundreds and hundreds more of people who've been able to take a condition that they've lived with their entire life and have a solution that allows them to empower themselves to change it, that teaches them about their internal process, that teaches them about their mental state, that teaches them how to gain control of their mind so they can gain control of their perspective on their condition, the way they interact with people in the world, the way they interact with their disease, and ultimately improve their quality of life.
It's fantastic. You know, Ariel, we were chatting before we started our interview, and you were telling me that your experience with exponential medicine in particular was really formative in where you are today. I was hoping you could share a little bit more about where you see the value in a conference like this.
So a conference like this really is a conference like no other. Forget the fact that we're at the beautiful Del Coronado, so you have this amazing environment that makes it very warm. It now has been several years of exponential medicine. This is my 3rd or 4th year being here and presenting. And so it has really created a community. So you know coming that you're both going to meet a community of friends, and you're also going to meet innovative new thinkers who are coming into the pool and want to learn and want to share. At last year's Exponential Medicine, we met individuals from the Radboud University.
Right.
From there forward, they purchased Muses, and they've now rolled out a study that they've done across at least 50 individuals. I know they have 50 devices,
right,
looking at a variety of different neurological interventions. So these kinds of really innovative partnerships happen here at Exponential Medicine, and they're relationships that continue to roll out and move forward.
Well, I'm very excited that you were able to share your story with us today here at the GuideWell Insights Lounge. Thank you for sharing your time with us. We're going to go ahead.